Hey everyone, welcome back to my channel. It's Dr. Alessandro. Please like and subscribe. In this video, I'm actually going to be discussing a topic which the group Action for Dental Nurses, a British group of dental nurses, also known as dental assistants in the United States, brought to my attention. It's an important matter. And I want to thank personally Kim Edwards for the opportunity to do this video and to bring to light an important subject, which is, quite frankly, the pay. I'm going to be direct. The pay that British dental nurses receive. So Kim was kind enough to share a lot of information with me, and I was poring over it. And there were a couple of things that delayed the production of this video, but finally it's here. Now, I did run some numbers, and I have to say that I did see a couple of trends in the British dental community. Now, one of them was, of course, the pay. That is, there is a startling 88% of British dental nurses that are earning less than £25,000 per year. Now, that's the equivalent of roughly, right? So do say roughly, the exchange rate does change around over time, but about $32,000 a year. So most British dental assistants earn less than that. Now, here in the United States, I would like to run some numbers or find out some numbers as far as what the average is here. But I can tell you that even in kind of a rural area, for example, our semi-rural area, which if you want to call it that, that's where we are. We're semi-rural. We're not really out in the sticks. We're in an agricultural zone. And we do have some fair-sized towns within half an hour or so of this region. But average pay, to me at least, from what I'm looking, is greater than that. That is, I kind of ran, again, the numbers that I saw, kind of the different pie chart distributions and things like that. And I would have to say that overall average pay here in this area is greater. I did also notice that a lot of British dental nurses do not have any benefits associated with their job, and that's a big problem. So what I'm going to say is that, I know that there's a crisis over in Great Britain with as far as the availability and the numbers of dental nurses, and I think it's really critical that employers, whether it be private practitioners or their national health system, whichever system or whichever way you go, begin to start to fairly compensate these folks who are extremely hardworking. My dental assistants here, dental nurses, they really do an excellent job, and they are hustling. I can't say enough good things about the team that I have. We have an extraordinary group of people that really are a fantastic team, and they are in constant motion all the time. And they're pitching in, helping each other out, helping the hygienists out. It's a wonderful thing to see in motion, because they really go over and above and beyond, and it's amazing. It really is. So what I'm going to recommend for those kind employers over on the other side of the pond is that maybe they consider doing the same, because they may face a crisis. Currently in the United States, there is a sort of a crisis of shortage of workers in the dental field. Of course, we have the great shortage of hygienists, and then there's the shortage of dental assistants. They're tough to find. Good ones are tough to find. So that said, employers over there, pay heed. Start to realize that if you're not going to pay, people will start to look for other opportunities in other fields and literally other industries as well. And I would say that if they aren't already considering it, they're already moving that way. And if you want your practice to run smoothly, your patients to receive the care that they should receive, and everything to work well for your patients, which should be your number one priority, make it your priority to take care of those who take care of the patients that you are treating. So that said, hopefully this was helpful. Hopefully this is a message that the employers and National Health Service take a good look at and start to really seriously consider, or really, quite frankly, immediately implement. Consider adding benefits to what you offer your dental nurses. consider adding extra pay or bonuses or something special, something that will make your folks feel appreciated. That's the most important thing. Make your folks feel appreciated. So with that, thank you so much for joining me, and I hope you're all staying well and healthy.